of dental care access for children with special health care needs, and how this has been an ongoing challenge for many years. I got into this fight basically about 10 years ago when I had a California Children's Services young adult who had had a gunshot wound to the spinal cord, was paralyzed, had dental pain. UCSF had gotten rid of its in-hospital dental program, and he ended up being hospitalized 7 times in the year, twice for dental pain, and each of those 2 times, he ended up, because he was paralyzed and had other issues, he ended up being hospitalized for an extended period of time. Both times, all related to the dental care. They couldn't actually care for the dental care, and he was still hospitalized for multiple days, 7 to 10 days, had other infections that complicated the hospitalization, and each of those hospitalizations cost over $220,000. All of that money would have covered all of the costs for preventive health care, dental care for youth with special health care needs in San Francisco. And so at that point, I was like, okay, that's wrong. We need to fix this. We have not completely fixed it. I know that you are going to tell me that in a second, because I would like to see a hand of all families who have a young person with a disability at home who have had trouble finding a dentist who is either able or willing to see your child. Or maybe you showed up at the office and they said, oh, actually, we can't take care of you, and sent you home to find something else. Yeah, I saw a lot of hands. One more time, hands up. Okay, and then on Zoom, anybody on Zoom, go ahead and put a hand up if you've had that challenge, difficulty finding a dentist or dental care for your young person with a special health care need. So, all right, thank you. So with that being said, I just want to say we've made a lot of progress in trying to advocate for changes at the state level in order to try and get more dental care access, get more people trained, try and get special needs dental facilities funded. We will talk a little bit about some of those optimistic possible changes in the future. Right now, again, we're looking at changes to Medi-Cal that will potentially decrease the Medi-Cal reimbursement rates for dentists, which will then cause dentists to flee providing care to people on Medi-Cal. So the answer there is probably that FQHCs will be the place where you can find dental care. If you can find a federally qualified health center with a dentist, that may be an answer as we struggle to get more dentists back on Medi-Cal, FYI. Some of the challenges that exist right now, I'm just going to talk about that because then we're going to get into the hopeful future. But right now, some of the challenges are there aren't enough general dentists willing to see people who have special health care needs because they don't feel comfortable. They haven't had enough experience actually in training. So the next thing is that training systems are now required to provide dental education that provides experience for dentists treating people with special health care needs, but those programs are very variable as to what they're treating, what they're training, and we need to increase the number of general practice residency or advanced practice dentists in training, so we're working on that. There have been some big successes in Sacramento in particular because Dr. Paul Glassman, who was really the father of virtual dentistry and the virtual dental home, has started to create a program here that is actually functioning, doing well. And we're hoping in other counties to emulate that if we can get some grants to fund virtual dental homes, and you will hear a little bit about that. And then right now, there's a challenge with long wait times for general anesthesia dental care, and a lot of general anesthesia dental care isn't necessary if you can provide behavioral support for people and give people a chance to actually get comfortable being in a dental office. Maybe they don't need sedation, and so that's called shortening the line to general anesthesia care, and that is one of the things we hope to accomplish? Well, when we're talking about the problem of dental care access, the most important thing, I think, is to start with the patient-family experience. And I want to welcome Francine Williams, who is here, AKA Bailey's mom. And I'm wondering if you, Francine, if you could talk a little bit about the family experience when trying to find a dentist for your child.
Yes. Hi, everyone. Let me introduce myself again. My name is Francine Williams. I'm a mom. I'm from Southern California. And I'm going to be talking about my experiences accessing dental care for my daughter, Bailey. It has been quite of a struggle for us. A lot of dentists aren't properly trained to deal with kids that have special needs. So a simple routine dental visit can turn into an extreme traumatic experience for us because it's overwhelming for my daughter. If you have a special needs kid, you understand that. Sometimes when we're just walking into the office, it's overwhelming for her, and sometimes the visits that we have had feel pretty rushed. It almost feels like the provider wants to, because they don't know how to handle her or handle the situation, it tends to feel very rushed for us, and in the same sentence, my daughter's still not receiving the care that I feel she should be getting. So, it's really hard. We're still looking. Right now, we currently do have a provider because she did have some dental work that she needed to get done, but that was another traumatic experience because she had to get some crowns, and they told us, they were gonna do it, and I suggested her being sedated because she clearly wasn't able to sit, it was just gonna be really hard for her and hard for me to watch as a parent. And at that time, they told us that the sedation wasn't covered by Medi-Cal, and we would have to pay out of pocket for that. And the cost, I believe, was about $1,300, and at the time that was pretty steep for me, especially me not working right now because I've been a full-time provider for my child. So, but we did have to go ahead and move forward with the work because she really needed it. But that was just a really traumatic experience and painful for me to even watch. I cried watching my daughter go through that. And I just don't feel like families should have to choose between, clearly, things that your child needs and financial, struggle. And it's just not fair. And like Ben was saying, I think it's very important that we have providers that are trained to deal with kids that have special needs, and just be a little more patient with us and the families, because we want the best for our child, and we want it to be an easy experience for everybody here, their provider included. So that's the experience thus far.
Can I ask, just to follow up on that, what would work better for family? If you were to have the ideal office experience or the ideal dental experience that you could create, what might be some recommendations you would have?
For me, an ideal dental experience. Okay. So the ideal dental experience for me, I think that some offices, some providers should have maybe a sensory room for kids with different special needs. Maybe a little quieter setting in that room for them, be a little more understanding, patient, be more skilled and trained when it comes to dealing with a special needs child. And just, that all comes along making the family feel a little comfortable, because I'm not going to want to have my daughter somewhere where it's uncomfortable for us. So comfort is like one of the biggest things, and understanding and patience, really, to be honest, along with the sensory, I think that would be great. Mm-hmm. So that would be ideal for me as a parent.
Yeah. That's excellent. Yeah. So one of the challenges is, like, a lot of dentists are afraid of the extra time that it's going to take, and there is a billing code now, right, in the Medi-Cal dental billing code list that does provide some extra money for dentists who take extra time, but the dentists have to be willing to prove that they've done the extra time and that the child had a developmental disability, and so not all dentists are doing that code and know about it. And then the sensory room, that's a brilliant idea. At this point, they're for like desensitization visits, having somebody be able to come to the office over and over again. Some dentists are doing that, and out of the goodness of their heart, kind of they can't bill for it, and so that's a challenge. That's something it would be really great for us to push for in the future. If there could be some way to reimburse those kinds of desensitization visits, it would be great. Or if there was a program that was designed to provide support that way. And I want to introduce Diana Aguayo. By the way, thank you so much, Francine. Diana Aguayo is our care coordinator for oral health care in CCS San Francisco, and she is on my team really advocating for improving dental care access in San Francisco in the Bay Area. And Diana, I'm wondering if you could talk a little bit about some of the more promising solutions or opportunities for improvement of care for people with special health care needs, at least in San Francisco and maybe beyond in California.
For sure. Okay, so first, and I also want to add that I am a dental hygienist. So in my heart, I am so passionate about oral hygiene. And Dr. Ben will see me running, and some families, moms may recognize me running around with toothbrushes because I feel so deeply that everyone deserves a toothbrush. And in a bigger picture, I feel everybody deserves a dental home. And it's so important as soon as our first little tooth comes out that we deserve that home to go to. So I want to name that I know it is extremely difficult to get dental care for all of our children and even adults, or especially our adults. But I would like to highlight a few things that are very promising right now that are happening. And Dr. Ben briefly mentioned it. It's Dr. Glassman's shortening the line model. And he was recently honored at the UCSF Developmental Disabilities Conference for this exact work. And so what this model is really focusing on is that so many patients are being referred for general anesthesia and sedation. And we simply don't have the resources to do that for every single patient. And so families are waiting months to years to receive any type of care. So this really is focusing on reducing the number of people who are referred for sedation or general anesthesia. And we're doing this by focusing on prevention, early intervention, and less invasive treatment options. So what does this look like? It looks like fluoride treatments. It looks like dental sealants, SDF, which is silver diamine fluoride, and that helps stop cavities early on, stop the progression, along with behavioral supports for mild behavioral supports in clinics, and also like helping families improve daily oral hygiene at home. So this is really, instead of defaulting to general anesthesia immediately, we're trying to find more pathways to care. Another model is the virtual dental home model. And this model is great because it provides preventive and basic dental care in places like our schools, our residential facilities, and other community environments to really bring the care to the families and meet them where they're at, instead of having families trying to navigate our already very limited and very complex oral health system. And then the other thing that I wanted to bring up is that we're trying to increase our dental residency programs. The more exposure and experience dentists and dental hygienists and dental assistants receive while they're in school, the more comfortable they're going to be when they're out in private practice and seeing patients with complex medical needs. So what I love about all of these models is that we're really trying to expand our oral health system and really get, she agrees. Yes. So instead of expecting families to fit into a system that really wasn't designed for them, because I do feel like the dental office, this is a personal take, was designed to benefit the dentist and the staff to make our lives easier, but we have no consideration for the families. So all of these models hopefully will be more patient-centered and family-centered.
I want to talk, thank you so much for talking about that. And the virtual dental program is one that's really exciting, right? You have a dental hygienist, a dental assistant, and possibly a behavioral person going into where people are spending their day. You know, if you're a regional center client and you know, you live in a group home, like if you have this dental team come and they don't have the expensive dentist, right, but they are providing these preventive services, and then if they do identify something that needs surgical intervention or some extra care, they can send x-rays to the dentist, and then the dentist can set up that care later, right? This is like a brilliant model that we hope we can expand over time. Some of the things that have happened before the Medi-Cal reductions that we're looking ahead to is that there were $50 million in grants that were awarded in 2023, and those are going to start happening. The money is going to start flowing, and there are going to be special needs dental facilities that are made throughout California. There are 13 of these that have been awarded. They're up to $5 million grants. I know in the Bay Area, there's one at Highland Hospital, and there's another one at the University of Pacific in San Francisco. They're going to be building out facilities. So this is really exciting in the next several years, and so there'll be more facilities that are serving people who have specialized dental needs in this way. Again, we're going to be pushing UCSF and University of Pacific and hopefully other universities to expand their dental residency program so that we have people who have extra training. And then there are certain schools like La Clinica de la Raza out of Children's Hospital Oakland, where they now have a new pediatric dental director who was at UCSF, but his name is Dr. Ray Stewart, and he wants people coming to him for direct training through the programs that they're doing at La Clinica. So we're excited about that, possibly increasing people's experience, general dentists' experience serving people with special health care needs. And then just pointing out that FQHCs will still receive a higher level of reimbursement every time a patient comes to be seen there. So that's where, if they have dentists, that would be incentive for them to see more people. And I'm hoping that people who have Medi-Cal will be able to go to FQHCs to get dental care, but we have to push those dentists and those FQHCs to have more spaces like Francine was talking about, maybe build out a sensory room, have a dentist who has more experience or have a behaviorist at the FQHCs. So we're going to want to push for that kind of restaffing of FQHCs while Medi-Cal has these reduced reimbursement rates, if that indeed is going to be happening. To finish up, I just because I know we're a little bit behind time, is there anything you would add at the end of this for the community that you think you would want to share that would help them in gaining access to dental care?
Hello? Okay. So, yes, Ben, I just want to say, you know, my daughter Bailey, she's an amazing kid, and the dentist is just something that has been scary for her, you know, for a while. And for any parent, I just want to say, moving forward, you know, keep on trying and looking until you find something that's comfortable for you and your child. Don't be afraid to speak up. You know, ask questions. hey, do you think that you're able to accommodate my child? You know, ask questions. I used to be afraid to ask questions sometimes, or just wouldn't, because I just feel like the door would just automatically be closed on us. And in me learning to advocate for my child, I have learned to start speaking up and asking those important questions, those hard questions, whether we like the response or not. So just keep on looking. And from what Ben was saying, I hear we have some really good things coming. So I'm looking forward to that. Bailey, you have anything you want to say? Okay, I guess not. I guess she's all good. She's going by what I'm saying, what her mom says. Mama knows best, okay? So, yeah.
Hello. Okay. And I would just want to add that finding dental care, it can be so frustrating and discouraging. And we do know that. But you're not alone in this, and there's so many families that are also in the same boat. Ask your case managers. I'm a part of CCS, and we don't always have like every single answer, but a mom called me last week and said, I just didn't know to ask you. Ask your case managers, ask, and we're more than willing to reach out and find out, and get you answers that you need. There's also so many oral health champions out there, whether they're providers, advocates, organizations that are really, really working tirelessly to increase access to dental care. And our system is evolving, and it's going to take some time, and it is taking time, but we're moving in the right direction. And I think as the more we share our experiences and we raise family voices, the more change that we can make together.
Will you talk a little bit about, just briefly, about UOP and your conversation with them and orthodontic care? Yeah,
for sure. So I'm a part of CCS San Francisco, so I called UOP because so many families need orthodontic care. Ortho is extremely expensive, and the private practices in San Francisco are ranging between $8,500 to $10,000 for a comprehensive treatment. So I reached out to UOP, who was so gracious, and they were willing to work with CCS and provide a lower rate for children who need orthodontic care, if you're a CCS client. So reach out. I think their pricing, it's still expensive. University of the Pacific. It's a dental school in San Francisco. Yeah. The question was, what is UOP? And they're a dental school in San Francisco. So their price range is still about $5,000. If you're a CCS client, it's about $4,000. But we could always have that discussion. So please reach out.
There's some questions.
All right, we got some questions on Zoom over here. So first, the question is, I live in Fresno. Are they planning to open a specialized dental place in Fresno?
Ooh, that's a good question.
Dr. Ben says that's a good question, and now he's approaching the mic.
I am not, if you look up, if you can look up on the internet, if someone can, the 13 special needs dental facilities to be funded by the $50 million grants in California, you'll get a list of the 13 facilities that are being funded and where they are. I think I might have seen Fresno on that list. I might be wrong, but it's on. I mean, it's on the web. Anybody if finds it, raise their hand.
We got a Kern County.
Okay, Kern County.
And Sacramento County.
Just those two? Oh, you mean the closest to Fresno? So maybe not Fresno.
Let's repeat that. The two closest to Fresno are Kern County and
Sacramento.
Sacramento.
Yeah.
All right, we got another Zoom question. Who can provide lap pads or fidgets?
Lap pads or Stidgets? Fidgets. Or fidgets.
Fidgets.
Lap pads or fidgets.
It's like a weighted blanket.
For dental facilities, or for like personally, that where would you go shopping for something like that? I mean, yeah. Amazon's an easy choice for just about everything, but There's a question over there. But yeah, for sensory devices, is that what it's called?
San Joaquin County is also going to have one.
Oh, by the way, there's also a San Joaquin County special needs dental facility that's being developed.
I was actually just going to speak to the Fresno person. I work at Valley Children's. I know that is in a conversation of trying to open a dental clinic. It is, like you said, it's trying to get providers and the whole system in place. But that is something that's been in conversation with the CEO. So, fingers crossed.
Are they an FQHC? You know, is Valley Children's
Dr. Ben, into the microphone, please, so Zoom can hear you.
Is
Thank you.
Valley Children's Hospital a federally qualified health center?
No, but they have partnerships with them because I work them.
So that may be the way that they could do that successfully. So if you are in touch with them, yeah, have them consider joining with a federally qualified health center to do that work.
Hi again. Question. I'll get to the question quickly. I had a child who was 3, and she needed some medical services for oral care. And the dentist wanted to sedate her. And I was just like, I had the choice to either have 3 grown people hold down my child who was female or to get her sedated. And so obviously she didn't get the dental care. So my question now is, because my daughter has a wonderful dentist, but they still want to sedate her. It's environmentally nice, it's colorful, they have a TV and all of that. But if I have a dentist that is not experienced working with children who have special needs, is there like a paper that we could say, hey, you guys are wonderful, why don't you guys get your staff trained to know how to do this? Do you have a form like that? Is there something that's like that? Could you create something like that? Or am I just out of my mind and thinking that's so far-fetched?
Oh, do you have something to say about that? Yes. Wait, can you bring us?
Okay, we got to wrap up quickly, though, friends.
CCS actually has a document for working. It's called Dental Care for Children with Special Healthcare Needs. We were actually on the panel to create that from families, and it talks about how to work with a child with a disability, a wide array of disabilities, how to brush their teeth, how to talk to them, how to prepare them for the dental visit. If it's not online, it should be in the CCS Alameda counties.
Why don't you make it available to Family Voice?
Okay. It's at the table? Okay, so yeah, so it's there, and that's something that you can actually bring to the dentist's office and have that available. It's something already.
There's also a curriculum that is being developed, there's already a curriculum that's been developed for general dentists in order to try and help them get up to speed on serving people with special health needs and with autism in particular. And right now, the dentists, at least at UCSF, they're trying to sort of update that. So in the next year or two, the goal is for there to be a better training for general dentists that's available online. The problem is that when general dentists do that, but they don't actually have the physical experience of working with somebody, they just won't do it. So that's the challenge, but your point is great. Is there something they could bring? Mm-hmm.
All righty. Thank you, Dr. Ben. Thank you, Bailey. Thank you, Francine. And thank you, Deanna. We are going to jump over to the CCS, California Children's Services Emerging Issues and Solutions